Understanding your HIV self-test results. You took a rapid HIV self-test. That's great. It's the first step to knowing your HIV status. No matter your results, knowing your HIV status allows you to continue your journey and choose options to stay healthy.
Introducing Abbott CheckNOW HIV self-test. Check your HIV status with yourself. Identifies HIV infection in a few easy-to-follow steps, cost-effective and scalable. Blood-based. Third-generation HIV self-test delivering more accurate results. Private and stigma-free. Abbott CheckNOW HIV self-test instructional video. Materials but not included in the kit. Timer, tissue. Included in the test kit. IFU, test device, alcohol pads, plaster, buffer, lancet, specimen dropper, disposal bag. Wash hands in warm water and dry. If no warm water is available, rub your hands together. Choose ring finger or middle finger. Massage and rub your hand finger to increase circulation. Clean your finger with alcohol pad. Let it dry for 10 seconds. Remove lancet cover. Press the F-lancet against the finger until it clicks. Massage from the base to the tip. Let 2 drops of blood fall into the basin. If you are having difficulty, wipe finger clean and squeeze again. Squeeze the top of the dropper. Dip the dropper into the blood in basin. And release slowly to draw blood into the dropper. Place dropper over the well. Squeeze the top of the dropper to apply 1 drop of blood into the well. Hold buffer bottle vertically and apply 1 drop of buffer into the well. Start the timer. Read the result in 15 to 20 minutes. Do not read past 20 minutes. Interpretation of results. Positive result, double line. Any faint line is considered positive. Negative result, single line. Invalid result, no control line. Place all the materials into the disposable bag and seal the disposable bag. Dispose in the infectious trash can. Distributed by Allied Hospital Supply International Corporation.
Let's talk about the next steps and how to understand your self-test results. If your self-test result is negative and you haven't had a possible exposure during the previous 3 months, you can be confident you don't have HIV. If you're unsure about your self-test result or possible recent exposure, visit a healthcare provider to get tested again. If it's been less than 72 hours since you think you were exposed to HIV, get to a healthcare provider to get on PEP. It's a post-exposure medicine that can help prevent HIV. If your self-test result is positive, you will need a follow-up test to confirm your result. Go to a healthcare provider to get follow-up testing. If your second test is also positive, it means you have HIV. People can feel many different emotions when they receive an HIV diagnosis. You're not alone. You have people waiting to support and help you get treatment. People with HIV who get and stay on treatment live long and healthy lives. So if you're diagnosed with HIV, it's important to get into care and start HIV treatment right away. Taking HIV medicine as prescribed can help you become undetectable. Undetectable means that the amount of HIV in your blood is so low that a test cannot detect it. Being undetectable helps you stay healthy. And when you're undetectable, you don't transmit HIV to sexual partners. You have options for keeping yourself and others healthy and safe. Condoms are highly effective when used the right way every time you have sex, and they prevent other sexually transmitted infections and unplanned pregnancy. If you use needles to inject drugs, never share needles or works to prepare drugs. HIV negative? Prevent HIV your way. There's also PrEP, or pre-exposure prophylaxis. It's medicine that, if taken as prescribed, is highly effective at preventing HIV from sex and injection drug use. No matter your HIV test result, you can find healthcare providers who will work with you and respect your choices for how to stay healthy. There are many people and community organizations to support you, no matter what your result is. If you want to start PrEP or need to start HIV treatment, reach out as soon as possible so you can get the care that's right for you right away. Remember, the only way to know your HIV status is to get tested. And rapid HIV self-tests allow you to test in the privacy of your own space, on your own time, as part of your health journey. Visit cdc.gov/HIV self-testing to learn more about HIV self-tests.